Welcome everyone to the Bainbridge Island Senior Community Center's Something to Talk About. I am very excited to have with me today Kelsey Lynch, who is the Community Health Navigator with the Bainbridge Island Police Department. She was just filling me in about a little bit about her position and how it's now full-time with Bainbridge Island. And we're very excited to have you here, Kelsey, and I'll go ahead and turn the mic over to you.
Well, thank you for inviting me. It's been, I know, a while since the first kind of invite, but then COVID happened. So things got a little chaotic with that. Like Katie said, I'm Kelsey Lynch. I'm the behavioral health or community health navigator with the police department. It is somewhat of a newer full-time position on Bainbridge Island, where we are partnering a mental health professional with the police department to assist in not only active calls for behavioral health crises or, just like things like welfare checks or anything where there is a level of kind of concern from the officers that the individuals involved in those calls might need some kind of support service. But then a big component of my role is also follow-up connection to care. So I work with individuals and families in the Bainbridge community to identify services that might help support them to alleviate some of the behaviors or the concerns that are requiring them to utilize 911 services, whether that's through the fire department or through law enforcement. And the hope is that if we can get them connected to the right, maybe mental health services, social services, caregiver support services, really kind of whatever that individual or that family might be needing, that if we get them the right amount of services and the right connections, that will help divert them from having to utilize 911 as a resource. And so the hope is by working with a mental health professional, I have a master's degree in clinical social work, that we can help them, overcome those barriers to maybe treatment services and wrap them up so that they are having their needs met in the community rather than maybe having to go to the hospital or having their behaviors or their concerns escalate further to where they're now, having maybe criminal components to some of their crises. So my position has actually been around for a little while. I've been in this role for almost 4 years now, just over 3.5. But previously, the position was funded through our community mental health tax, the 0.1% mental health tax in Kitsap County through a grant out of the city of Paulsbo. And my position was contracted with Bainbridge Island Police Department part-time until this year. In 2020, the department decided that Bainbridge is somewhat of a unique community. We have, a little bit different demographic and a little bit different kind of perspective from the police department about what services and what resources would be beneficial for Bainbridge Island, maybe compared to the rest of Kitsap County. So we were very fortunate that the department took a very active role in this program and trying to adapt this program to what our community needs, and asked City Council to fund this position full-time going into the 2021 cycle. So I started, I actually had to reapply for my job, which was a fun process, but I started full-time on Bainbridge at the end of January of this year. And with that change in time allocation and having the city fund the position rather than a grant, we were actually able to really expand who I work with and how. Under a grant, you have to be very specific in what your capacity is and how you take referrals and what your process looks like in that regard. taking it full-time under the police department through the city allowed us to be much more flexible in how I work with the community. So previously under the grant, I was only able to take referrals that had 911 interaction. Now, as a full-time city employee, I'm able to take referrals from community members, from other community agencies, if they are identifying some concerns for maybe an individual or a family that they have concern could escalate to the point of law enforcement or 911 services being involved. They can actually reach out to the department directly to get a hold of me so that we can actually try to intervene and support that individual before we reach a crisis level that would require 911 to be involved. So that's been a wonderful expansion and use of my services for, I feel like, the community members. The school is a partner that I work with on a pretty consistent basis. I take a lot of referrals from Bainbridge Island High School, and we have a wonderful working relationship. And then the other component that changed with my position going into this full-time position is that the department put a big emphasis on providing support for individuals that are the victim of sexual assault or domestic violence. I am a certified victim advocate, so I work with our detectives to help support victims during the interview process and help keep them informed of what the criminal process looks like so that they are up to date and feeling supported so that they have, the information that they need, while also getting them connected to trauma services so that they can kind of process the things that they've been through and hopefully, move on in a positive manner. So I wear a lot of hats. I do a lot of different kind of moving pieces. My job is super flexible, so it's been wonderful to kind of take on some of those new components. But I live and work on Bainbridge, so I take a lot of pride in the community and being able to support kind of whoever needs help, however I can.
Oh, Nancy, do you have a question?
Yeah. What's keeping you most busy since you've been there?
That's a hard question to answer. I think that every day is different because I can respond in the field with officers. So depending on kind of what's going on in the community, I might be spending that day mostly doing in the field outreaches. Or on other days, I will be in victim interviews or that kind of thing. I think the piece that has surprised me coming off of the grant process is how many individuals in our community are open and willing to just reach out to the police department to access my services. I think it's always a unique, somewhat scary process to have to, call 911 or call a police department, but access to services is actually really hard here because we're on an island and we don't have a whole lot of different support services locally. People aren't quite sure how to gain access to some of those. So I am surprised and excited about how many people are willing to kind of come in and talk with me or reach out to the police department to say, hey, we're seeing this concern in the community or in our family, or I need help. That has been a shift of my work. So that has been, I think, more of my time than I thought it would be when I took on this role full time.
And how did they find you? How did they know you were there?
We've done a couple kind of press things. The city and the police department itself did a few announcements on like Facebook. I did an interview with Kobe Connects and did a kind of question chat lunch Zoom meeting with the chief of police. It's great working for, a smaller close-knit community, is that it's kind of easy to get the word out through different agencies and different community events like this, it's really great to kind of be able to easily disseminate that information.
Mhm. Super, super. Thank you.
Yeah.
So I was gonna kind of ask, along those lines in terms of how people connect with you. So people can just call into the police department if they feel like they might need your services, or just looking to kind of understand what resources are available, where to go.
Mhm.
And so they're able to do that, just contacting you directly through the center. And then of course, it sounds like also on those 911 calls when appropriate, you'll also be connected with folks as well.
Yeah, a lot of times through like when there is a crisis, or if somebody, wants to talk to a police officer, that's always through 911. It's challenging because that is such a unique thing to Kitsap County. I feel like that there's not a non-emergency line where, it's such a smaller community that even if you just have a simple question for a police officer, we're going to tell you to call 911. And that's all handled through our dispatch center. And it's not an inconvenience whatsoever. It's just the process in Kitsap County. And because I'm only one person, I work a pretty standard 9 to 5 schedule throughout the week. So a lot of times crises or incidents happen mostly at night. And so a lot of what I do with families is after that crisis, the officers will refer that situation to me, and then I will do follow-up. But families and individuals are always welcome to just contact me directly. All of my contact information is on the PD website, so it's out in the community. People can call or email me directly. And then, it's always our hope that we can provide support and resources so that we don't end up in a situation where somebody does have to call 911 because we're in crisis right now. If we can, kind of reduce some of those concerns and reduce some of the symptomology before having to go to the hospital, like that's always our preference.
That's great. Thank you, Kelsey.
Yeah.
I was also just curious. So what are some of the organizations that you partner with, and are you connected to like CPS or APS, and how does that relationship work? And I'm sorry, Child Protective Services or Adult Protective Services?
Yeah. So it's working for a police department is a unique position for a mental health professional. This is not, it's a newer model that departments throughout the country, I'm sure people see on the news, the push for partnering social workers and mental health professionals with law enforcement is an up and coming trend. And each department is trying to figure out how to best approach that. Many agencies are contracting with a treatment provider to place a mental health professional within their department. Bainbridge was very passionate about me being a law enforcement employee, working directly for the department. And that helps in a couple ways in that I am not HIPAA bound. So I'm not taking in protected medical information nor providing a treatment service. So I'm not doing therapy, I'm not doing evaluations. My job is to really be able to connect to whoever is going to best benefit that individual or that family, which allows me to very easily work with Adult Protective Services, Child Protective Services, and any treatment agency that I think would be the right fit for people, because I'm not associated with anybody other than the police department. I think that gives me a lot of flexibility and fluidity to really work based on what the individual needs are. So officers will refer me to individuals that have CPS reports or APS reports that are being reported to the department. I also am a mandated reporter, so if I feel like that needs to be initiated, I work with those agencies to, make those reports and help connect to services. So the fact that I'm a police department employee allows me to have a lot of flexibility and choice in how I work with agencies. But I have found, and I think I would hope that DSHS, who houses CPS and APS, the Department of Social and Human Services, feels like this is a great ability for them to also access information. They will often call me to see, what my experience is with those families, and see what services I've connected them to if they're also working with a family on the island.
Great, thank you. Other questions for Kelsey?
Yeah, I have another
Nancy?
one. So what do you think? Okay, okay, give us a scorecard on like what you think Bainbridge offers strength-wise in services, okay, or not Bainbridge, just Kitsap. You refer to the county, right?
Most of the time, yes.
Yeah, right. Okay, so in your professional opinion, what are our strengths in this community, and what do we need some more of them, or whatever, I don't know,
Sure.
like a scorecard kind of.
I think, in terms of strengths, Bainbridge is unique. The fact that we are an island has created some challenges. I'll talk about that in a sec. But especially when COVID hit, we definitely have a population on Bainbridge Island that has trouble accessing services, due to trying to age in place and not feeling comfortable being out in the community when, especially when we were talking about people over the age of 60 being a huge high risk population with COVID. And Bainbridge community members came together in such a beautiful way to help support those individuals. So we would get a lot of calls from family members across the country being concerned about their parents or their grandparents who live on Bainbridge, being able to access food because they were afraid to go to the grocery store, having things like their lawn services or yard services being taken care of, because that can create things like trip hazards or fall hazards for individuals that are trying to age at their home. A lot of people lost caregiver services. Bainbridge community came together in such a wonderful way that I could work with a family and then have community members be able to go grocery shopping and drop off food and do all sorts of smaller tasks that there aren't services in place for. I think that was an eye-opening experience for a lot of us about what daily living needs some people can't access because they just don't really exist. And our community, filled in some of those gaps.
Not too many places have IVC.
No, not too many places do. In terms of services that we lack, I would say it's pretty sweeping across the board. Kitsap County is unfortunately very closely located to a major metropolitan area where a significant amount of funding goes for services, being so close to King County and Seattle and so close to Pierce County below us. Yeah. We're a little bit isolated in that we are a much more rural community and county in general. And all of our services are isolated in Bremerton. So for North Kitsap County and Bainbridge, the vast majority of our social services, our community mental health agency, our hospital, all of those things, our homeless shelter, major food resources are all located in Bremerton, and we have pretty awful public transportation in terms of accessing that. And it's also hard that we have only one community mental health agency. Everybody that has Medicaid services, which is actually a higher percentage of Bainbridge Island than I think most people would assume, have to go to Bremerton to access mental health treatment, substance abuse treatment, any kind of shelter if they are experiencing homelessness. You know, we don't have those evenly distributed throughout Kitsap County. So it creates a lot of challenges. I think that is my biggest struggle, is that especially as an island, you know, if somebody has a severe mental health concern, we're asking them to take at least 2 different buses, if not 3, to get to a service provider and then turn around and get home. And as a neurotypical, fully functioning adult, I would struggle with that. So asking somebody in crisis, I think that's pretty unreasonable.
Yeah. So can the hospitals be approached to do something more locally in that regard? Or is that not their bailiwick? Does it have to be a social service, in other words? Yeah.
A lot of it has to do with social services. The hospital transferring to Silverdale has actually been kind of wonderful in terms of access to medical care. Our hospital doesn't have a psychiatric component to it. They contract our crisis services and our like inpatient treatment to Kitsap Mental Health, which is located in Bremerton. I think one of the challenges about Kitsap Mental Health and you know, bringing some of those services north is that, one, we just have a provider shortage. You know, there's not a huge population of social workers or therapists or mental health professionals that are readily available and who haven't gone into private practice because, let's be honest, it pays a lot more. So I think that's a challenge. And then there's also the challenge of the constant, like, not in my backyard. You know, I think with communities like Bainbridge and Paulsbo and North Kitsap County, there's genuine fear around, if we bring social services to this area, is that going to increase our homeless population? Is that going to, you know, bring to light some of these other challenges that we're seeing in major cities that, you know, we don't necessarily want to see in downtown Winslow? So I think as much as communities are often very excited about the idea of increasing social support services, we then get into the battle of like, well, where do we put them so that it's not in my backyard?
Right.
And I think Kitsap has, you know, had that challenge for quite a while.
Yeah, the homeless have a lot of woods that they can hang out in, and so that we don't see them. So
yes,
not handy. Yeah. Thank you.
Yeah.
But just a little follow-up, and only if you're comfortable at answering, or I know I'm putting you on the spot here, but based on what you've seen in your work and what you've experienced, do you have sort of like a dream project or a dream program that you would love to see implemented in Bainbridge? And it, you know, vague, if that's totally fine, since I'm kind of putting you on the spot here.
I think yes. I would love to see Bainbridge be in general more collaborative. And what I mean by that is that we have a huge population of private practice clinicians on Bainbridge Island. We actually have more therapists than I thought we would when I first moved to this community. The challenge is that we also have a huge population of individuals who can't access those services due to insurance challenges. And so one of the things that I see a lot, especially with my work with the high school, is that, we have people that have higher levels of need than can be managed with just like an outpatient individual therapist. And so I've, talked a lot with Bainbridge Youth Services and a couple other programs on the island that work especially with youth. And we would love to see, I think, some more kind of wraparound collaborative approaches to working with an individual and with the family, and how we can kind of really support individuals from the ground up earlier on. I think that is something that is challenging in such a tight-knit community. I think there's a lot of desire for individuals on Bainbridge to kind of keep things a little bit more behind closed doors and handle concerns within the family. But I think that's actually a huge barrier to accessing services if we're not more open about, some of the challenges that people are facing and some of the needs of the island. I think that is actually a deterrent to accessing services and getting service agencies to really work together to provide more wraparound care. I would also really love to see more clinicians on Bainbridge and more services on Bainbridge, except Medicare. Medicare and Medicaid treatment providers are few and far between. But that's a pretty big portion of our population on Bainbridge is, supporting individuals who are trying to age in place and have access to Medicare is great sometimes for the medical component, but not for the mental health component. Accessing support services for individuals on Medicare for substance abuse treatment, which is a huge thing, or for mental health support, especially for, like the grief process and the loss of a partner or your independence. I have a very hard time finding providers that will accept Medicare clients.
Mm-hmm.
And it's something that I'm asked for quite often. And when there's, a 2 to 3 month wait list for accessing services, at that point, people just give up. That's a lot of work. That's a lot of persistence. That's part of my role is to kind of hold people's hands through that process so that they don't get kind of burnt out and disengage. But when there's a indefinite wait period, it's really hard to kind of keep people motivated and keep people feeling like, they will eventually get the support that they need. So it's a struggle.
Yeah. Yeah. And I imagine, I'm not sure if you see this, but, for folks who are maybe, experiencing some crisis or, have housing instability, I would imagine, when you're waiting for 3 or 4 months to get services, by that point, you may have a different phone number, your address might be different.
Mm-hmm.
And I know sometimes it's like, you get that letter and you're given X number of days to respond. And is that something that you see also where folks can sometimes, because of just their personal circumstances, sort of lose out on being able to get those services when the time comes?
Yes. I think that especially around housing instability, there's for individuals who are able to access things like HUD housing or like a Section 8 voucher for lower income housing support. I got off the phone with a housing agency just yesterday, and they said that they have a 3-year wait list to access housing. So, in that time, in 3 years, so much can change. And if they move or they don't fill out the right paperwork at the PO box that they can't check because now they don't have transportation there or whatever it is, all of that waiting is for naught. So there's actually, you have to be really on top of your mail, your email, your phone to really kind of get access to services, which is super challenging for a lot of people. Pre-COVID, that was hard. Post-COVID, or I guess still in COVID, there's a lot of barriers to services. I think I spend, a significant amount of my time actually just faxing in paperwork for people because they don't have access to a fax machine. And how that is still like a HIPAA accepted modality of getting paperwork, I'm not quite sure, but it is. So it's something that I spend a little bit of time just helping people send things because it can be challenging.
Yeah, I think this year we experienced a lot of that through the center and also through IVC, how I think people take for granted just the access to technology and, well, I mean, a fax machine, but yes, that's still sometimes needed. And it's like, when folks don't have access to computer, internet, smartphone, fax machine, what another huge barrier that can create in terms of tapping into these types of services. So yeah, I mean, a big shout out to you and your role of being able to take on some of those things, because yeah, without it, again, it can really, basically make it inaccessible for folks. So.
Yeah. Well, and especially on Bainbridge, we have terrible cell service. So a lot of people, end up missing things because, their house is in a dead zone or, whatever challenges they're facing. And with the libraries being closed, that changed people's access to computer and internet services. So many of our services went to digital online platforms for therapy and treatment. This isn't always the best modality for, doing in-depth trauma work or substance abuse treatment. It's a hard platform for quite a few people, especially if you have challenges with technology. So we saw a huge kind of transition in treatment processes that are not actually equitable for quite a few people. So it's been a unique going on, a year and a half, almost 2 years at this point.
Kelsey, any final words that you would like to add today, or anything else you'd like to share?
I think the biggest thing is if you have questions, feel free to reach out. My contact information is all public. So if people have questions and they reach out to you guys, feel free to pass along my email and my phone number. It's all on the city website, the police department. So I'm happy to answer questions or take referrals from community. And yeah, I'm here. So use my services.
Perfect. Well, we really, really appreciate that. And we really appreciate you being here. Again, you can find Kelsey through the police department, the city website. You can also contact the Bainbridge Island Senior Community Center. We can also help you track down information and get you connected to Kelsey. Thank you so much, Kelsey, for the work that you're doing for the community. It's huge. It's so important. We really appreciate it. And we really appreciate you joining us today. We hope you'll be back again soon.
Of course. I'm happy to come on anytime.